Hey, welcome everyone. Good afternoon. It's 12 o'clock on a Wednesday. We're so happy to see you here today at our adult low risk drinking session. This session is titled Balancing Celebration and Safety, Navigating Alcohol and Family-Friendly Environments. This is the third session of our Project Echo series focused on adult low risk drinking, where we gain insights into best practices and share our collective experiences. My name is Sarah Kondrak, and I'm pleased to facilitate the first Project Echo Hub dedicated solely to supporting the behavioral health prevention and promotion workforce. With approximately 1,400 hubs in over 200 countries, we're really proud to leverage this model to bring an innovative prevention resource to Ohioans. So this Echo Hub is facilitated by the Ohio Center of Excellence for Behavioral Health Prevention and Promotion, and you can visit our website listed on this slide to learn more about the center's work. The center is funded by the Ohio Department of Mental Health and Addiction Services and administered by Ohio University's Voinovich School of Leadership and Public Service in partnership with the Pacific Institute for Research and Evaluation, or PIRE. If this is your first time attending an Echo session, welcome. We're so glad you're here. This is a really inviting and inclusive space. It's probably most important for you to understand the core philosophy of Project Echo, which is all teach, all learn. In each session, we'll start with a subject matter expert providing a didactic on an identified topic, and then hear from a community member about their work and experience. What makes Echo so special and effective is the value that everyone in the room brings knowledge and experience to the session to make a contribution. All teach, all learn. On this slide, we're highlighting some of the key benefits of Echo. Notably, this model democratizes access to information and expertise. That means that knowledge is shared equitably, ensuring that everyone, no matter their location or professional network, has access to the latest best practices. Echo ultimately builds workforce capacity by empowering professionals across different sectors with skills and knowledge they need to make an impact. So some practical tips for today. Please mute your microphone when you're not speaking. It is lunchtime. Please eat lunch. But if you can, turn on your cameras. These sessions are intended to build connections and community, and we really like to foster relationships with our colleagues. I encourage you to use the chat feature throughout the session, particularly if you want to share relevant resources. We will capture all of those resources added in the chat and add them to our session notes for you all to have at the end of the session. Finally, please reach out to my incredible colleague, Nancy Clough, if you're having any technology issues. She's happy to help. So as a hub team, we are committed to creating an inclusive environment and providing all necessary accommodations. We'll start and end sessions on time and work hard to make good use of your time by providing quality content. The only recorded part of this session will be the didactic presentation, and this is out of respect for your privacy and the community members you serve. Finally, please know that we will be providing continuing education credits within 30 days of the session, which you can earn by completing the evaluation that's provided in the chat at the end of the session. So we also ask our participants to help us create a safe, respectful learning environment by valuing the opinions of your colleagues, using inclusive language, and protecting the privacy of everyone involved in keeping discussions confidential. We encourage you to be open and sharing your experiences, knowing this is a supportive space. And I'd like to remind you about the schedule for our upcoming Echo sessions. Our Youth Vaping Prevention Echo meets the second Wednesday of the month, and our Adult Low Risk Drinking is the fourth Wednesday. We're not meeting in December. But we also wanted to let you know that we're really excited to launch a new Echo in partnership with the Ohio Coaching and Mentoring Network and the Ohio Prevention Professionals Association, called Advanced Prevention Practice, Enhancing Skills and Impact Together. This six-session series will be held the third Friday of the month, beginning in January, and the intended audience is Ohio's experienced prevention workforce. Please sign up and spread the word. If this is relevant to your work, we would love to have you. And with that, I would like to introduce you to our presenter today. Her name is Amber Wolfram. Amber works for an agency called the Family Resource Center as an adult prevention specialist. She has over 25 years experience providing and monitoring substance use prevention and mental health promotion efforts in Hancock County, Ohio. Amber completed her undergraduate work at the University of Toledo, her master's at the University of Findlay, and she is an Ohio certified prevention consultant and has been one since 2002. Amber has spent most of her career in behavioral health, facilitating evidence-based prevention strategies, assisting with Hancock County's recovery-oriented system of care transformation, educating about trauma-informed care approaches, and working to create measurable outcomes to prove that prevention works, treatment is effective, and people do recover. I also want to call out that Amber serves on the statewide Adult Low Risk Drinking Advisory Committee, which helped inform and guide the content for this ECHO series. Thank you for your service and welcome, Amber. We're excited to hear from you.
Thank you so much. I am going to start by sharing my screen. Please let me know if you're unable to see it. I want to thank the Ohio Center of Excellence for Behavioral Health Prevention and Promotion for this opportunity. And to know that while I am the subject matter expert on this particular one, I did not even do this presentation on my own in true collaboration form that we have here in Hancock County. I was aided by the Association, the Statewide Prevention Coalition Association, the Hancock County Community Partnership, which you are fortunate to hear a little bit more from later, the Montgomery County Prevention Coalition, and also Talbert House and the Safe Communities Coalition of Warren County. So I will share a little bit of their details as we move forward. But again, true collaboration form. We're very fortunate here in Ohio to have a wealth and depth of prevention knowledge. So I'm not going to let that go to waste. So here, moving forward. Did it advance? Yay. Thank you. Thank you, team. So this is me. It basically says I am old. I'm trained in a lot of things. I am vintage. I've been here a hot minute. I've worked with voluntold audiences and volunteer audiences, and I like working with both equally because I love watching light bulbs go off with individuals that think I'm just wasting their time. So I have been a trained facilitator with Prime for Life, the lifestyle risk reduction model, since 2001, and became a minimize risk, maximize life facilitator just last year. So been working with the attitudes of low risk drinking for quite some time. So our session today is specific to exploring the challenges and opportunities of managing alcohol consumption in family-oriented settings, and hoping that you will gain insights into creating inclusive and enjoyable environments while prioritizing safety and well-being. So first off, it's not really usually prevention's role to create inclusive and enjoyable situations where alcohol will be served. So when I first read this, I was like, "Ooh!" But how do we help other community entities, organizations, businesses that are choosing to mix the two? When asked, how do we assist with the knowledge that we have is how I'll be spending the time today. Learning objectives, recognizing the opportunity to promote low-risk drinking among adults as they influence youth consumption decisions and practices. And in our committee meeting yesterday, we were even discussing how much words matter. And as I'm speaking today, I hope I can emphasize that more when we're talking about low-risk drinking. Are we wanting to emphasize the drinking, or are we wanting to emphasize the choices? So challenge that for yourself as you're hearing me speak today about what messaging are we putting out when it comes to what verb are we actually accentuating in our descriptions of what we do. Develop strategies to promote safe, family-friendly spaces and reduce alcohol-related risks. So in the next 16 minutes and 20 seconds. That's what I plan to share with you. First, I wanted to find out, what does family friendly mean? Um, and I thought, well, we'll Google it. And this was the definitions that I found. Family friendly just basically means suitable or aimed at families with children, with synonyms like age appropriate, PG, family centered, child friendly. What was missing in all the things I searched was there's nothing that says that family friendly means substance free. And so that often comes down to what our own perceptions are about what family friendly is and what our community's perceptions are. So I thought, well, where can I get perceptions outside of Hancock County? Well, I can Reddit it. And that's what I did. So I went out and started looking at some other public opinions about what people thought about the term family friendly. A Reddit post from 7 years ago highlighted that a beer tent was being removed from a festival to be more family friendly. And the gentleman wanted to know if he was being, if he was being sensitive to that. And the responses were primarily, no, they shouldn't remove a beer tent just because it's family friendly. Kids need to see adults behaving responsibly to know what responsibly looks like. They're going to lose money. We have events, and if there's not enough kid events, the parents complain. They want more kid events at our family-friendly events where there's alcohol. And then finally, one person wrote, well, isn't beer served at Disneyland? And when you think of family-friendly environments in your own community, that might be a very similar question, whether it be a Chuck E. Cheese or a Dave and Buster's, a ball field, a football stadium. In the Toledo area, we now have our zoo is serving alcohol, which wasn't there before. So great questions to put out there and pose for what does family friendly mean. Another post from just 9 months ago was talking about advertising events at breweries specifically for kids. And surprisingly, there was a kind of a little bit of switch in the perception about it, where people said, that's kind of icky. We really shouldn't be, like, should be allowed in breweries if families are allowed, but we shouldn't be having events specifically for kids at breweries. One individual responded, no. Another individual responded, sure, call the event Crumble the Cheerios on the Floor night. So public opinion about family friendly, again, changing. I found a post from the beginning of November where someone was asking, like, did it seem to anyone else that it appeared people were getting drunk around their kids a lot at these different events that were being held? And this one was very mixed, where people were saying, no, it was worse in the 70s. And others saying, no, it was better than in the 70s. So you can kind of get the range of people that were responding to the post. Some individuals saying it all depends on your circle of who you hang out with. Do you have friends or do you have drinking buddies? That might design like what kind of night you're ending up with, which then some individuals responded, well, one person wrote, well, if people are going to get drunk, they're going to get babysitters. And people chimed in, well, you obviously don't live in Wisconsin, you don't live in Michigan, you don't live in Iowa, you don't live in the Midwest. So it was interesting stepping outside of my own community to try to find what family friendly means. Obviously means a lot of different things, which leads into the rest of the presentation. So I also then looked up event organizers. What do they think? And overwhelmingly, what I found is they stated no alcohol, no money making. But there's ways that you can do some quote harm reduction, change the tickets colors if they're underage, train your volunteers, do things like that. There was mixed reviews about mocktails based on the perception of who you're marketing them to. Are you marketing them to adults or are they kiddie cocktails? So all of this to say it's a timely topic, I think, because it appears as tobacco and vaping and things are becoming more frowned upon in community settings and social settings. It also appears that alcohol is becoming more present. And we see that with DORAs, at least in Ohio, becoming more prevalent in communities small and large. So what does prevention know about all of this? I'm not going to read you statistics, but what we do see from a 2023 standpoint is alcohol is a legal substance, but it's age restricted, right? 21 and over. Public perception says, well, how are kids supposed to know how to be responsible with it if they're not seeing adults being responsible with it? What we do see is that in ages 12 to 17, according to the study and the survey, we had 21% of youth, 12 to 17, who said they had had alcohol at some point in their life. And of those, we had 7% that would drink in the last month, 4% that binged in the last month, with binge being defined as five or more drinks for a male in one occasion, four or more drinks for a female. Now, again, trying to compare an adult body to a child's body as far as how alcohol impacts them is very different, but they use the same terminology for youth and adults and determinations. And then less than 1% reported heavy use, which would be a binge definition more than five or more times in 1 month or within 30 days. So having that information about youth, we look at adults, and the range was 18 to 21, 18 to 20 being not a legal substance. But we see, interestingly, that when you start to look at like year usage and past month usage, while the numbers are 67 and almost, 52, I see when I'm talking about low risk and when I'm thinking about low risk, I see some additional numbers in there in that I see 33% did not drink alcohol in the last year. 76.5% did not binge drink in the last year, and 94% did not drink heavily. So when we start going into messaging and family-friendly events and as a prevention field or a community coalition, how do we want to address those situations? My question becomes, who are we targeting with our message, and what are we wanting to promote in our messaging? And as I shared earlier, it is looking like a more timely topic. A quick search on the internet about family friendly and alcohol came up with a bunch of different articles, some in Ohio, some outside, about is it acceptable? Is this something we want to continue to perpetuate? What are people's thoughts on Doras? What are people's thoughts about kids in bars as pubs, breweries, bars are starting to really the line between them and a restaurant's getting grayer and grayer, right? So first, we have to define what is our community role. Wherever you live, what is your community's role in these family-friendly events, whether it be a business or a local community event? The community sets the cultural and social norms. They set the regulations. Now, of course, there's state laws, but they're responsible for the safety and well-being of everyone attending their events or their business. What's the public health aspect? What's our local data say about adult use and youth access at family-friendly events? What's our desired outcome for the event? And how are we going to engage the adults who are going to hopefully be monitoring the youth at these family-friendly events so that there's accountability and responsibility? That's the community's role. And as preventionists, we then have a role as well in defining, are we involved? So the reason I posed this question in the beginning to our work group was I had been asked as the adult prevention specialist in our county to provide information at an event that was going to be family friendly, where there was going to be alcohol. And they said, you could either have like a kids table or you could, do this or that. And, I said, well, what's my role there? We have to define that before we just say yes, because in many situations we want to be there to make an impact, but what impact are we attempting to make? Who is the audience that we're hoping to reach at an event like this or in a local business? What is our message? Are we promoting low risk choices, or are we trying to reduce high risk consequences in relationship to this legal substance? And then what best strategy do we use, which we'll touch on in a second? and what are our desired incomes and our desired impact. So my comment back to that community organization was, no, I'm not going to be present at your event, but I would love to provide the low risk drinking guideline details to you to have where the alcohol vendors are, so that if the adults are coming up and if they choose to purchase an alcoholic beverage, they understand the low risk guidelines. That was something I could do for promotion and universal prevention without me being present and maybe muddying what my intended message was about the event itself. Often we are reactory. We know something's getting ready to happen, and so we want to respond reactory to what's being proposed. I have someone coming on a little bit later from Hancock County, Zach Thomas, who will be sharing kind of what we can do at a larger 50,000, view of our community to help maybe be more responsive and proactive versus reactory. But I kind of challenge everyone to think about this when they know that there's alcohol being served at a family-friendly event, to really think about what is our intended role and message, and what are we really promoting, because there's more research out there when it comes to prevention that sometimes our messaging gets mixed, or the message that people hear is not the message that we intended at all. And we'll get into that here. So what are the strategies that we use? The best practice evidence-based strategies are the ones that are on our continuum, which start with universal, targeting the general population or entire community with a message or with a strategy to reduce the risk and to promote awareness and healthy behaviors. So if we're really shining a light on the fact that we have so many individuals that are not drinking in an abusive way or drinking in a high risk way, how are we promoting that at the events and opportunities that we have in front of us? 94% did not drink heavily in a national statistic. So what does our local data say, and how can we use that? And this type of prevention, we're trying to impact everyone. We're trying to reach everyone with a message. So this is where promoting substance-free events is something we have a local control over, to really highlight, yeah, families can be out and have fun and not have alcohol present. That's a universal. With selective, we're targeting individuals or groups who are more at risk. We understand that even by the notion of the event, there may be high risk behaviors that are being encouraged. A local Oktoberfest having a drinking contest where everyone has to drink a large drink, which is about probably 2.5 to 3 servings of beer in one quick gulp in succession to try to beat the other team. That's a high risk drinking experience. So how do we target that particular event differently than we would maybe a restaurant, where that's not being highlighted as one of the activities that is part of the experience? Getting access to more screener tools to those type of events, or education with specific demographics, especially the individuals that will be serving or will be monitoring the event. What do they need to know? And will that possibly impact their decisions about what they're highlighting? And then indicated, targeting individuals who are already exhibiting early signs of substance use. I don't know what other communities have with their colleges. Many of our local bars in our area have closed because the kids aren't heading out. They're not going out. They're going to coffee shops and things. But that's not the case everywhere, obviously. So again, knowing your community and where you need to really target potentially a harm reduction message, and working with your community safety nets to find out what those messages need to be. Law enforcement, adult probation, juvenile probation, unfortunately, peer recovery centers, people who are working directly with individuals that have these indicated concerns. So the right strategy and message at the right time really comes down to local data, pushing for resilience building, protective factors. Again, if we have 50% of adults not drinking within the past month, how do we really highlight and promote that? and what those choices then look like and materialize to look like with healthy families. And are we promoting low risk guidelines, or are we needing to really focus on high risk consequence warnings with avoiding scare tactics? There's a great document by the Great Lakes PTTC and SAMHSA that just came out in September of this year about what does not work in prevention, misuse prevention. How do we avoid fear arousal and myth and fact scenarios and things like that that we find actually do the opposite of what we were hoping to do, and understanding how much words matter. And then understanding the harm reduction, promotion, and education is about the concerns of those really high risk decision making, not necessarily on the low risk choice promotion, and keeping those messages separate because we can often sound like alarmists. If we come out and say, oh, if you have alcohol at this event, all these bad things are going to happen, and our local data does not support it, we may lose some of our credibility and lose some of the people listening to what it is we are trying to actually say. I have in my slides for you to review on your own just what we're fortunate in Ohio to have some local coalitions that are doing great work on using some of the strategies by trying to reduce use when it comes to alcohol among youth, but also to promote low risk use among the adults. And I encourage you to take a look and see what they are doing. And as promised, I didn't spend a lot of time on Hancock County and what we've been doing because I'm fortunate to have a community partner joining to share those things with you. But I look forward to, if you have any questions at the end, being able to share those, share some additional information with you. So thank you for the opportunity.